Hey, well, it's great to be here today at Te Pai in Christchurch. I'm here with Nick Chamberlain. He's the head of National Policy Health Service at Health New Zealand. And it's great to announce that the government will be lowering the age for the bowel cancer screening program from 60 to 58 for all New Zealanders. And we've also announced that our intention is to match Australia over time as access to more colonoscopies and as we can financially afford that over time, because it's really important that we are doing everything we can to make sure we can reduce the burden of bowel cancer in society. But today's a great day for that, and just wish the Cancer Society all the very best with their conference, and happy to take any questions.
Prime Minister Christopher Luxon promised in a pre-election debate that you would lower the bowel cancer screening age to 50. Is this a broken promise?
No, not at all. We are focused on delivering what the Prime Minister said. We will lower the age to match Australia as the financial resource and the access to colonoscopies allowed. That was acknowledged by the Prime Minister and the Minister, our finance spokesperson at the time, Nicola Willis, and also the Labour Party, when they were asked the same question during the election campaign, that access to colonoscopies and the financial resource are the two factors here. And actually, I can get Nick Chamberlain to speak to that. But one of the critical factors here is actually access to colonoscopies and the ability for us to be able to do those tests in the community. So we're absolutely committed to continuing to lower the age. Today's the first step in doing that, and we're committed to doing that over time as resource it allows us to do.
Will you lower it to 50 in the future?
Well, actually, we've said we want to lower it to match Australia, and Australia's at 45. So we actually want to go beyond 50 to 45. But what we're saying here is there's some critical limitations, and we need to make sure that Health New Zealand is building its capacity to be able to do more colonoscopies in the community. As that is able to be done, we will continue to lower that age over time.
Do you have a timeline?
Look, not at this stage. What we're focused on here today is to say we've got funding and we've got the access to the right number of colonoscopies to get this down to 58 from the end of this year in 2 regions, and for the rest of the country by early next year. As that access to colonoscopies builds over time, which is something that Health New Zealand is going to be incredibly focused on, that means we'll be able to make further decisions in the future to lower that age even more. So today's about setting the direction of where we're going. We want to match Australia, but actually there are some resourcing constraints in the meantime, and as we grow that capacity, we will continue to lower that age.
Maori and Pasifika have been able to get access in a couple of regions until 50, but those pilots are all coming to an end. Do you not see the value in Maori and Pasifika having that early access?
Well, those people in those communities will still continue to be able to access it from those who started that program at 50 will still be able to continue through. But what we're saying here is the evidence from the Ministry of Health is very clear that by lowering it to the age of 58 for all New Zealanders, we're actually able to save, I think it's 178 additional lives for over the next 25 years. So this is going to save more lives across the next 25 years than the previous government's approach, and that's what we're doing, targeting the resource so we can save more lives. That's what this government's doing.
Do you accept that Maori and Pasifika are more likely to be diagnosed with bowel cancer earlier?
Well, what we've done here as well is, and you would have heard in my announcement, is we have also included a range of initiatives to increase the amount of testing in Maori and Pasifika communities. And what we've seen is, if what you see in the evidence is actually there's a lower rate of testing in those communities who are eligible. And so by being able to change the way we approach those communities, provide drop-off places where they can drop off their tests, promotional campaigns through Pacific health providers and Hauora Māori providers, we're able to actually increase that capacity. There's actually a significant amount of resource being put into trying to get those testing rates up in those communities, so the effectiveness of this program can be much more effective for Māori and Pasifika communities.
Bowel Cancer New Zealand met with you a couple of days ago. What did they say to you when you said that you would only lower the age to 58?
Oh, look, we didn't discuss, Cabinet only made this decision on Monday, so we met prior to Cabinet's making decisions. But look, we discussed their proposal, which is to lower it to 45. Cabinet has agreed that we should be matching Australia as resourcing allows. So we agree with the Bowel Cancer Society's advocacy. That's the direction that we want to go in, and we will as access to those colonoscopies and financial resource allows us to.
Minister, can you give us an idea of what lowering the age to 58 will mean in terms of staffing and how many extra clinicians are needed?
Well, I can get Nick Chamberlain to talk to that one if you like.
Sure. Thank you. So we know that by lowering the age to 58, we'll save an extra 566 lives over the next 25 years. It will require additional colonoscopy resource, and it will require additional staff. We are going to put in those resources, but we're also introducing a new test, which is called a FIT test, for symptomatic patients, which will significantly reduce the demand for colonoscopy. So we will be lowering the colonoscopy demand as we increase the demand from the bowel screening program. And we know that probably around an extra 1,000 to 1,200 colonoscopies will be required. But that's out of 60,000 that we're currently doing, so it's a relatively small percentage increase.
And do we have the capacity for that currently?
We're working on that for over the next few months, and so we've got till October to start the program, and then March for the second half of the program, and we'll be absolutely working on implementing FIT testing and ensuring that we do have that colonoscopy capacity. It is a big challenge, but we are looking at that.
Great.
Why did you go against official advice from John Carnegie to the Board of ECO?
Well, John Carnegie is someone who has significant experience in the energy sector. And he's someone who Cabinet agreed to appoint to provide that expertise to the Energy Efficiency and Conservation Authority. And actually you want people on that authority who understand the energy sector, as he does. He's the right person, and look, that's officials are welcome to their advice. We actually think we need people with experience on public sector boards, and that's what we do.
Doesn't it so undermine, I suppose, the recruitment process?
No, not at all. We actually want to have people with experience, and he's got a significant amount of experience in the energy sector. And he brings that wealth of experience and that perspective to the Energy Efficiency and Conservation Authority. And their job is to make sure we are efficient with energy, and there's across all types of fuels, and that's the focus that he's going to bring to that role.
Where do you stand on man-made climate change?
Well, look, ultimately, that is a significant issue that this government is very focused on achieving our net zero targets. Climate change is something that we're very concerned about. We're focused on meeting those net zero targets by 2050. And Minister Simon Watts is doing a huge amount of work to address that issue across government, both as Minister of Climate Change and as Minister of Energy.
I'm sure there's a lot of work going on, but where do you personally stand on it?
Well, my view is that climate change is a significant issue facing New Zealand, and that's why this government is taking it very seriously to make sure we're addressing it and to meet our net zero 2050 targets.
In terms of the resignation of Adrian Law, what did you make of it?
Look, those are questions that you put to the Minister of Finances. That's where you put those questions. Great. Thank you very much. Thank you.
Thanks.
Cheers.